Okay. All right, Lloyd. My name is Jessica. I'm a student nurse, and I'm going to be here today, and we're going to do some suction and cleaning of your trach today, okay? I noticed you're sounding a little bit gurgly. I'm going to take a listen really quick to your lungs. Oh, yeah. Okay. So, first I'm going to attach your O2 sat monitor and keep an eye on those while I'm doing this procedure. And this is going to help make you feel better, okay? And I want to, first of all, go ahead and have you raise your hand if any of this is getting too much for you, okay? So I'm going to stick a little tube down and suction up those secretions. And if it gets to be too much, you need to raise your hand and let me know, okay? Alrighty, first I'm going to test the suction machine. Turn it on. And it's within the normal limits.
Could you show me how you test it?
Yes. So I'm going to turn it on and stick my thumb to suction. And I'm watching the level of pressure on the gauge over here. I want it to be around 140 for a portable suction, 130, 140.
Yeah, it depends on what kind of suction machine you're using, but yeah.
So I've checked that, and I made sure to wear gloves for that so that I don't get anything on my finger. So now I've assessed my patient, and I'm also assessing my scene. So I've got my emergency obturator if I need it during this procedure. I've got my ambu bag to hyperoxygenate my patient. So I'm going to have that out and ready. And I've got my suction kit and my normal saline. And I also am monitoring his O2 sats. I noticed that they're a little low. So I'm going to go ahead and open my kit, and then I'll hyperoxygenate and get ready. So let's set up my sterile field. So I'm going to open my sterile package, and I'm going to put on my sterile gloves.
No, you're going to open your canister.
I'm going to open my canister first, so that this is ready. I've checked the expiration date on that, so we're good.
That's okay, it happens.
Okay. This is where practicing sterile glove donning is very important. Okay.
Yay.
Okay, so now my sterile hand, I'm going to pull out my little cup.
That's going to be dirty anyway, so
Yeah,
that's okay.
so I'm going to take my dirty hand, designated my left hand as my dirty hand, and I'm going to palm the label and fill my cup. Set that aside. So my left hand is on my dirty hand, and I'm going to take my catheter out. Okay, so I'm going to set up this. I've already checked my suction, make sure that it works. I'm going to attach. Accordion this, keeping this sterile. I'm going to hyperoxygenate while watching his sats. His sats are a little low, Lloyd, so I'm going to give you a couple breaths, okay? Here we go. Sats are going up. That's good. Good. So I'm going to take off the ambu bag without pulling too hard on his trach. I'm going to turn on my suction and prime my tubing. Okay. And lubricate my tip. I only want to insert the catheter about 2 to 3 inches the length of the inner cannula. Okay, here we go. Raise your hand if it's too much. We're going to go straight in without suction. I'm going to remove it while rotating. Good. And I'm going to wait, watch the sats. Clean my tube out. Stats are a little low. I might give them another breath. Good. And we'll go one more time. Insert it. And out. Good. And then just clean. Good. His sacks are staying nice and high. You doing okay, Lloyd? Take some
He's
deep breaths
nodding.
for me.
He's nodding, so he's better.
Okay.
And roll that guy into your glove so you can throw the whole thing away.
Great. Yep, so I don't want to get my gunk everywhere. And I'll clean up. Okay, so I noticed that Lloyd needed some cleaning after I did some suction. So I'm going to gather my equipment. This is a clean procedure, so I don't need to keep it sterile. I'm getting a tray, bottle of hydrogen peroxide, normal saline, some gauze, if I need it, some Q-tips, and a split sponge to change the dressing. And then head into the room. And change your dressing and clean up. We made a mess when we were suctioning, okay? And I'm always making sure to check the cuff and making sure that the balloon inside is inflated and not overinflated. So monitor that during suctioning and everything looks good. I'm gonna put on I've done hand hygiene. I'm gonna put on my clean gloves and get ready to start. So I'm gonna fill my first little box with half hydrogen peroxide and half normal saline. And I would have checked my expiration dates and all of that. Palming the label. Half normal saline and then normal saline in the second one. I'm gonna open up my Q-tips and get some of these ready. And I'm going to get the split sponge open. This is clean as I can. Okay, so I'm ready to go. Okay, Lloyd, I'm going to go ahead and remove your dressing and your inner cannula. So I'm just going to pull out the split sponge that's already there and then unhook the inner cannula. And keep all my gunk together. Throw this away and drop it in my mixture of hydrogen peroxide and normal saline. And I'm going to just clean this. So I'm going to clean the inside. And if this Q-tip gets too gunky, I'll toss it. Clean the inside.
Sometimes kits have, what do they call? Pipe cleaners so that they're flexible enough to go all the way through.
Yep. Okay, so that's looking good. So I'm going to rinse it. So I'll put it in my normal saline mixture. Splash it around a little. Rinse it. And it's okay if there's some normal saline inside the cannula because that can break up some of the secretions. I might take a gauze, dip it in normal saline, and just kind of clean around if he's got some secretions or gunk. So clean around his trach and chest. And I'm going to go ahead and reinsert the inner cannula now. And kind of having it on the outside kind of helps to lubricate it also. So sometimes I might need to go in at a 90-degree angle and rotate and then push in and clip. Being careful not to push too hard and be gentle with the site because it can be irritating. And then I'm going to take my new split sponge and I'm going to, if my gloves were gunky too, I would need to change those out. So I can fold my split sponge like this. And I'm going to insert one side. Kind of wedge it under there. Doing okay, Lloyd?
He's nodding.
Get this other side up here.
And if you needed to change the ties, if they're really gunky, how would you do it? That side where I said,
Yeah.
Okay.
Okay, and so to change the tie, I want to make sure that it's always attached on both sides in case he coughs. I don't want the cannula to spit out. So I would place my new tie underneath. Oops, and if I can get it with my...
You could take your gloves off at this point. Right?
Take my gloves off to show a little bit better. So, if I can bend it up there. I'm going to attach my new one. Here.
It's the other side.
Okay, so I'm attaching my new tie while keeping my old tie on. Oh my goodness. Okay. Sometimes it's difficult to grab. There we go. Probably be better if I didn't have my split sponge on already too.
Yeah.
Because now this is grabbing, so I'd want to do it before I put my dressing on. Now I'm going to remove my old tie.
Perfect.
Sure not to
So
pull.
both are secured before you remove the old tie.
Yes.
Another thing that we didn't mention was, you know, with all the coughing that goes on, in reality you would want like a chuck sheet or a washcloth on the chest
Yes.
for both cleaning and